I want you to know, wherever you are in your pregnancy, you are a beautiful glowing goddess, okay? You right there, beautiful glowing goddess. Hello everybody and welcome back to my channel. Welcome to 2024. For those of you clicking on this being like, who is this lady that I subscribed to a year ago when I was pregnant, and you're now holding your beautiful baby before you hit that unsubscribe button, which I totally understand, please go ahead, leave your birth story in the comments. I would love to connect with you one last time. And of course, if you want to stick around and just learn a few more things, I would love that too. For those of you who are new, my name is Elizabeth. I am a labor and delivery nurse of 10 years, as well as a postpartum nurse, a certified childbirth educator, and mom to 3. So without further ado, let's go ahead and jump into things. I think a lot of us get super focused on, hey, my belly's gonna be growing. I have a baby literally forming its bones inside of me. How wild is that? But because we have that baby growing inside of us, other systems in our body are changing. Our immune system has to downregulate and also upregulate to make sure that we're not attacking our baby and letting it grow, but also to protect that baby. Our vasculature system has to increase because we've got increased blood volume, and we're also pumping all that increased blood volume to this new little handy organ that we made called the placenta. We are noticing a change in our hormones as those are increasing. So estrogen, progesterone, androgens, which are our growth hormone, relaxin, which helps our pelvis kind of change shape when it's time to birth baby, all to help support our pregnancy and to help with the birthing process. Those hormones aren't just going to our uterus, they're going to our whole system. So there's a lot of things that happen. I want you to know about them because I want you to be prepared, and I want you to know about them so that you know what's normal, what's not normal, what you want to talk with your provider about. But of course, don't just trust me. I'm just a girl on the internet. Am I a nurse? Yeah, but always talk with your provider if you're worried about anything going on. So starting at the top, let's talk about hair growth. We see some luscious locks growing in pregnancy, right? Everybody talks about the pregnancy mane. We've got these hormones that are flowing, and what they're doing is they're not really causing your hair to grow faster, but they're causing your hair, which normally goes through 3 cycles of growth, and one of those is a loss cycle, to skip that loss cycle. So instead of losing your average of 100 strands a day, that loss goes way down, and that hair length gets fuller, thicker, longer. Some people, even with these hormones, notice a change in curl pattern. Other changes that you might notice is hair on other parts of your body, right? Because it's not existing in a vacuum. It's not just this hair on your noggin. You might notice hair cropping up in areas that you didn't used to have it before. Raise your hand if you got a happy trail during pregnancy, okay? Exclusively. Nice little happy trail. You're not alone. Some people get hair around their nipples. Totally common. Sometimes maybe a little hair on your chin. Okay? We can pluck, we can tweeze, we can shave these areas if they're making us feel uncomfortable, but just know that all of these things are a result of helping your baby to grow. With these changes with our hair, another kind of common thing that we hear about are changes with our nails.
First things first. All right, we have to get you healthy. You need prenatal vitamins. Incidentally, they do incredible things for your nails, so that's a plus.
And that's true that the biotin in the prenatal vitamins might help with nail growth, but also being pregnant can make your nails grow longer too. But the other thing that they can also do, which is a little bit counterintuitive with those long nails, they can make them more brittle and more prone to white spots on the nails. As far as skin changes go, or other skin changes that we see, you might have heard of that glow of pregnancy, right? Oh my God, you're glowing. You look amazing. Your cheeks are rosy red. You have a little bit of extra shine. Increased vasculature is going to make your cheeks rosy. Weight gain, totally normal in pregnancy, is going to make us a little bit rosier more quickly, in addition to some more oil production on our face. Now that extra oil production might also lead to some increased acne, and while we can't use retinoids or anything with vitamin A during our pregnancy, high doses of vitamin A that we take orally are definitely not safe in pregnancy. Since our skin is our largest organ, high doses of vitamin A on the skin could potentially be harmful, so they recommend avoiding retinols and retinoids in pregnancy. But you can resume them postpartum. Thank the Lord. What I will say is we've got over-the-counter options that can be helpful. Benzoyl peroxide, salicylic acid, azelaic acid are all things that you can try, in addition to chatting with a dermatologist for finding a regimen that is helpful when you are breaking out in pregnancy because of that extra oil production and those hormones that can sometimes be responsible for a lot more breakouts, particularly on our chin. Now, there are some myths surrounding gender of baby boy versus baby girl. If your beauty feels like it's stolen, your nails are brittle, your hair is limp and has lots of split ends, you're breaking out with acne, you're having a girl, she's stealing your beauty. With a boy, you're glowing and fabulous. None of that's true. None of that's true. All a wives' tale, not scientifically proven. We just all respond to these hormones a little bit differently, and that is okay. So in addition to the other skin changes that we've already talked about, another one that you're going to notice more than likely is hyperpigmentation. This is due to an increase in melanin, which is what darkens our skin. It can happen anywhere on the body. On the face, we tend to see it as melasma, or the mask of pregnancy that can kind of go over the middle of the face. Now, one thing that you can do to help avoid this, or to help it not become worse throughout your pregnancy, is to make sure that you're using sunblock and a hat. On your body, you might notice that you have a linea nigra, which is the line that kind of goes down your belly. It's also common for your areolas, or the tissue surrounding your nipple, to grow and darken during pregnancy as well. Other skin changes that you might see due to the stretching of your abdomen, you might notice that your skin is a little bit more itchy. You might also notice that you're developing stretch marks. Now, stretch marks are basically just genetics, so you're either going to get them or you're not. Now, we can help soothe them, make things feel more comfortable, less itchy, less stretchy by applying lotions or even using silicone pads. Generalized itching is definitely something that we can see. Sometimes there might even be a rash associated with that itching. PUPS is the rash, and basically what happens is mostly on the abdomen, but it can spread to the arms and the leg. From the abdomen, we have some bumpy red marks that are pretty itchy, and we don't 100% know what the cause of this is, but we do know that the solution is giving birth. If you are noticing a lot of itching, especially of the hands and feet, that is definitely something that you want to touch base with your provider, because that can be a sign of intrahepatic cholestasis of pregnancy, which is a liver condition that we need to keep an eye on if it does develop in your pregnancy. But of course, with any skin concerns, definitely chat with your provider if things don't seem normal to you. Two more things that I want to address with skin changes that we tend to see fairly often is that there might be some changes in your moles. If you are a moley person like me, I have a lot of moles in a lot of places, you might notice that your moles are getting a little bit bigger. Now, they should still be symmetrical. They shouldn't change in a way that's concerning, as they could be cancerous, and you are not at an increased risk for skin cancer during your pregnancy, but skin cancer can occur during your pregnancy. So any mole changes that you're seeing, I want you to definitely double check with a dermatologist. But on our abdomen especially, you might see changes in moles as our abdomen increases and that skin stretches, or if you have moles that are close to your vulvar area or your groin area, you might see a change in those due to the vasculature changes that we experience in pregnancy as well. Another thing that you can see in that groin area in particular, or in your armpits, anywhere where we have folds of skin that are touching, are an increase in skin tags. Now, some of us are more susceptible to skin tags, particularly if we have hormonal disorders like PCOS or insulin resistance, but pregnancy also increases our risk of skin tags, because with extra weight gain, we're going to have some more skin rubbing together, and we also have those hormones going on as well. Now, often these skin tags might even resolve after pregnancy, so typically they're not something that we're going to take care of during pregnancy, although we can if they're bothering you, if they're bleeding, if they're irritating. Some things that we can do to help decrease the skin tag formation is just wearing loose clothes, so we're having less friction, less rubbing, and also maybe using a moisture barrier like Aquaphor or Vaseline, or just a moisturizer in those areas where we can potentially have a little bit more friction. Now, in addition to the hyperpigmentation, to the darkening of your areolas, some other changes that you're going to see with the girls is that they're going to grow. 1 to 2 cup sizes is kind of the average that we see. This is as our milk ducts are growing, as our vasculature is increasing, because our breast milk is made in the blood, so the blood has to get to the milk ducts. We're also going to see some more veining on the outside of our breasts. We might notice that those areolas get darker. That's kind of a bullseye for baby. They don't have the best eyesight, so that's going to help them get to their space. And what's really cool is that starting as early as 16 to 19 weeks, you might notice that you start to leak a little bit of colostrum. This might be that you wake up and you're a little bit damp from leaking, or even just that your nipples are a little bit crusty. All that is colostrum, which is our early and first milk that is going to be there for babies. Now, if you don't leak, that is not a sign that you're not going to have a full and robust supply. It just has to do with the tone of your nipples, and I don't know how one would tone their nipples, but maybe your nipples are just a little bit more toned than somebody else's. But if you're noticing absolutely zero breast changes, definitely a good idea to schedule a pre-delivery visit or appointment with an IBCLC, a lactation consultant, to kind of see if maybe there's any issues with your anatomy or with hormonally what's going on that might affect your breast milk supply after baby's born. Back up to the face, I want to talk about teeth and dentition. So we do know that there is an increase of gingivitis or inflammation of the gums and an increase in cavities during your pregnancy. There is a little bit of a thought that because your baby is needing extra calcium, it's sucking it out of your teeth. We actually don't have any scientific proof behind that. But what does happen in pregnancy is about 70% of people will have some nausea or vomiting in the early stages. Might be more often eating heavy carbohydrates and doing maybe less breasting because that's making them feel nauseated. They also might be noticing, because of increased vascularization, when they floss, there's more bleeding, so they're less likely to floss, less likely to be taking care of their teeth maybe as closely as they were before because they're extra tired, they're nauseous, first trimester is rough. So I want to really encourage you to continue all of your normal great oral hygiene habits and to continue to see a dentist during your pregnancy so that we can kind of keep these guys as clean and as healthy as possible, because having poor dentition during pregnancy can set you up for other risk factors related to birth that of course we want to avoid. And who wants to get a root canal while they're pregnant? A lot of dentists won't even do them. So we want to try and keep things here as healthy as possible, and prevention is key. Going all the way down to the bottom, one thing that you might notice in pregnancy is that your feet get bigger. Now, are your feet actually growing? Are the bones growing? No, but relaxin, remember that hormone that we talked about that helps make the pelvis a little bit more flexible, can also make that foot a little bit more flexible, and then extra weight bearing down can stretch out the foot and make it, you have a little bit more of a flatter foot, and can actually increase your foot length by 2 to 10 millimeters on average, and 10 millimeters is actually a full shoe size. The other thing that can happen during pregnancy is that we can have some swelling in our feet, and that can also make it a little bit harder for shoes to fit. So in the hospital, great to bring some easy slide-on sandals if you've got some swelling, and with that lengthening, sometimes that goes back to normal after pregnancy and sometimes it doesn't. The good news is we tend to only see that growth happen in the first pregnancy, if it's going to happen at all. Oh, if you notice really rapid onset of swelling, particularly in face, hands, any of those areas you're gaining more than a pound a week, right, in fluid, that can be a red flag for some extra screening for preeclampsia. But a little bit of swelling can be normal. Make sure that you're putting your feet up, that you're wearing compression stockings, that you're getting plenty of fluid will help your body to retain less fluid in your legs, ankles, and feet. Because the other thing that can happen in our body with that increased vasculature and that increased weight gain that we're having is the increase of varicose veins. And we can have varicose veins in a variety of places. Some people will get them in their legs. Some people will actually get them in their vulva or on their labia. And some people can actually get varicose veins in their rectum. Those are known as hemorrhoids. Those hemorrhoids, that roid rage, that we are taking a stool softener, maybe some magnesium, that we're eating a fiber-rich diet, that we are treating those topically if they are painful or uncomfortable to us. And also, they can be a sign of a dysregulation in pressure in our pelvic floor. So seeing a pelvic floor physical therapist if you're suffering from a lot of hemorrhoids can be beneficial as well. The other thing that can happen throughout your pregnancy is there can be a change in your vaginal discharge. This is because your body is producing more discharge to actually keep your baby safe, to help flush out bacteria. So you might notice an increase in clear, cream, or white colored discharge. The cream and the white are kind of flushing out that bacteria. But if you're noticing that the discharge is foul smelling, if you're noticing extra vaginal itching, if you are noticing any bleeding, those are all things that I want you to talk with your provider about, because those can be a sign that there's something else going on. Not always all the time, but definitely sometimes. So we just always want to be touching base with our provider. The other thing that I tend to see at the end of pregnancy, I noticed it in my own pregnancy, and I've heard other patients kind of share the same thing with me, is that you might notice swelling right? We talked about swelling in the leg, but also swelling in your vulva, swelling in your labia, just with that extra weight of pregnancy and all of that extra pressure in that area. So know that that's common and also nothing that I want you to be worried about as far as feeling self-conscious with your providers, because all of these things are things that we see commonly. All these things, we are here to support you in making you feel as comfortable as possible in your body and in your skin. And I just want you to know, if you've heard all of these things and you're like, oh my gosh, Elizabeth, this is too much. Too much is happening here. You're right. It is a lot. It's a lot that your body goes through besides just growing a baby to help keep them safe and healthy. And it's okay if you're in awe of your body and just think it's absolutely amazing. Or if you think, oh my gosh, this kind of sucks and I don't like it. You can feel these two feelings at the exact same time. I want you to know, wherever you are in your pregnancy, you are a beautiful glowing goddess, okay? You right there, beautiful glowing goddess. Definitely let me know if you've experienced any of these or if there's things that I didn't touch on in this video. And until next time, bye guys.